Dr. Clayton Molliver. I'm a clinical professor of surgery in the Division of Plastic Surgery at UTMB Medical Branch Galveston, which means I'm in private practice, but I'm on their clinical staff. I teach residents, we write papers together. I'm also a clinical editor of the Aesthetic Surgery Journal. Today I want to talk to you about toxins, meaning Botox, Juveaux, Dysport, those sort of things, and fillers as it relates to safety. And the reason why I talk to you about it is this past weekend, my nurse practitioner got a phone call from someone she had done Botox onto the forehead and crow's feet area. She had done it a week before. Lady told her that when she'd had it done once before in the past, she had puffy eyes for a few days. So, anyway, the week after the injections, the patient calls and says, my eyes are all puffed up and I've been taking Benadryl, but it's not helping. So this is what the picture looked like. So as you can see, her eyes were very swollen. Here's her pictures after we treated her. Okay, what did we treat her with? We gave her a Medrol dose pack. It's a very rare complication with Botox and presumably all the botulinum toxins that you can get an allergic reaction. And presumably this could be anaphylactic and be rather severe. When she called me, I hadn't heard of it. I checked with my colleagues, and we quickly, here in my practice, came up with a paper that was published in ASJ not too long ago about a very similar event, and we knew how to treat her. This can happen, and so the question or the point of this is that you have to be careful about where you get your work done, because in the state of Texas you have to be a nurse practitioner, a physician assistant, or a physician to treat someone with Botox or fillers, or you have to have a physician on site if you're just a nurse, or LVN, an RN, or someone else who's been certified. You have to have a physician on site who examines the patient and approves of the plan for toxins or filler. But it happens everywhere without any oversight. And if this complication happens, who are you going to call? So that's my concern for patients out there. Be careful where you go. The next thing I want to talk to you about very quickly is fillers. So this picture is the picture of what the vascularity of the face looks like. As you can imagine, you can hit a vessel very easily. In my practice, with my nurse practitioner and myself, we always use blunt cannulas in most parts of the face. The lips sometimes will go with a regular needle, but we try and use blunt cannulas everywhere. Why? Because you can inject a vessel. What are the complications of injecting a vessel? Well, blindness. Paper just recently published with 16 cases out of China of blindness, and you can't turn this around. It actually goes into a vessel, goes in the back of your eye, and causes blindness. If you're using a needle, you can easily get in the vessel. Well, who's injecting your face? Is it an LVN? Is it an RN? Is it a nurse practitioner? Is it a physician? Is it someone who's just doing it? And do they have the medicine on hand in their clinic to dissolve filler? Because while blindness is very, very rare, it can also cause this problem, and that problem, and that problem. These are complications from filler, where when it gets to a vessel, it can cause necrosis of the tissue of your face. So the complications are very, very significant. And if you have ischemia or an area where you're not seeing a good blood supply, you have to immediately inject medicine called hyaluronidase to dissolve the filler. A lot of people don't have that in their office. If it's some nail spa or spa that doesn't want to keep this expensive medicine on hand, maybe they don't know how to use it or recognize the problem. So be careful out there, folks. There's people putting needles in the face. They don't know the anatomy. They don't know where the vessels are, and the complications can be really, really severe. That's it. Just want to talk to you about safety and what's going on out there. Have a great day.